Hi, I'm Dr. John Mascarenhas, a professor of medicine and the director of the Center of Excellence for Blood Cancers and Myeloid Disorders. If you've been diagnosed with myelofibrosis or MF, it's important to know that most people living with MF have symptoms, but those symptoms can often go unrecognized. You might think that how you're feeling isn't related to your MF, or you may associate some of your symptoms with getting older. You may even get used to your symptoms, thinking this is your new normal, and may not notice them changing over time. But changes in how you're feeling could be a sign that your MF is changing too. As a rare chronic blood cancer, MF is also a progressive disease, meaning it can progress or get worse over time. Remember, new or worsening symptoms could be a sign that your MF is progressing, even if your blood counts are well controlled. This is why it's extremely important to understand the symptoms you're experiencing and immediately speak up about how they're impacting your life. When MF symptoms are caught early, they may be easier to manage. The sooner your healthcare team knows about your symptoms, the sooner they can start you on a treatment that may help relieve your symptoms and improve your long-term outcome. There are many symptoms associated with MF. Some symptoms are caused by having too many cytokines or proteins in the blood. These symptoms may include fatigue, night sweats, itching, bone pain, unintentional weight loss, fever, and concentration problems. Other symptoms are caused by an enlarged spleen. When the bone marrow can't make enough normal blood cells, the spleen begins to make them. This causes the spleen to grow larger, which can lead to other symptoms of MF, such as abdominal pain or discomfort and early feeling of fullness. Additionally, certain symptoms like weakness, paleness, or shortness of breath can be associated with anemia, which is common in people living with MF. So, when you're at your next office visit with your healthcare professional, here are a few important things to remember. Be open, honest, and detailed with all of the symptoms you're experiencing. Tell them everything. Don't leave anything out. Dismiss symptoms as something else, or downplay how you're feeling. This is your chance to make your concerns heard and understood so you can get the treatment you need. If you don't speak up about your symptoms, your healthcare team won't know how you feel and could delay starting treatment. But if you're experiencing any symptoms, don't accept the watch and wait approach. Speak up and advocate for yourself. Don't miss the opportunity to get the care and treatment that you need and deserve. One of the things that I do to make sure symptoms aren't missed is to ask my patients with MF to track their symptoms between visits. An easy way to keep track of your symptoms and see how they may be changing over time is by using the MF Symptom Assessment Form. This form will help you track the symptoms you're experiencing, assess their severity, and see how they might be impacting your quality of life. Using this form can help you communicate your symptoms in detail to your healthcare professional. The form will give them a better idea of how your MF symptoms are affecting you so they can start treatment sooner. Download the form now by scanning the QR code on your screen or visit voicesofmpn.com. Make sure you fill it out and bring it with you to your next office visit. So, what should treatment goals look like for MF? Treatment goals in MF include relieving symptoms and reducing spleen size to live a longer and better life. You may also have some personal goals you want to reach along your MF journey. Tell your healthcare team what those are and if you're experiencing any symptoms that get in the way of achieving them. Your healthcare team may recommend treatments such as blood transfusions, radiation therapy, surgery to remove the spleen, or a stem cell transplant to manage your MF. Your healthcare team may also recommend prescription medications to help control MF symptoms, including chemotherapy medicines or targeted therapies. Don't be afraid to ask your healthcare professional for a treatment plan that helps you reach your goals. The sooner you ask for a treatment for your MF, the sooner your symptoms may start to improve. And when your symptoms improve, you can continue to stay active, hang out with friends and family, enjoy your hobbies, and do the things that are important to you. Achieving long-term benefits like these start with earlier treatment for your MF. Remember, your symptoms are not a sign of weakness. Speak up and say how you feel. Be honest with yourself and your healthcare team. Ask for treatment to help and trust yourself. You are the key to noticing your MF symptoms and reporting them so that they can be properly managed and treated. Most important, don't wait to speak up about your symptoms. Ask to start treatment now so you can enjoy more moments later.